Away from the Eid celebration, the United Nations Children Fund reveals that it will use the next 700 days to reach 1 million unvaccinated children in the country to prevent morbidity from vaccine-preventable diseases. This followed a report released on the state of the world children by the International Children's Organization. And health correspondent Kemi Balogun has details.
Millions of children across the globe are at risk of losing out on disease-preventing routine vaccinations. The State of the World Children report reveals that at least 67 million children have missed out on vaccinations between 2019 and 2021. Out of this number, 48 million did not receive a single vaccine dose, leading to an increase in the number of zero-dose children. Nigeria and India account for the largest numbers of zero-dose children, with 2.2 million recorded in Nigeria. UNICEF says it is now time to do a lot of catching up and recovery to ensure that children are restored with immunity against diseases. It insists that routine vaccination needs to be on the front burner despite the setbacks brought on by the pandemic.
And the survey shows that 30% of the children are not vaccinated against Penta-1. So this is the indicator that we are using to inform the global estimates.
A misinformed person can take misinformed actions, and that is our function, all of us, to make sure our communities get the right information and timely.
The survey also found that 18 states in the country account for high numbers of zero-dose children, and UNICEF is seeking to improve the routine vaccination campaigns to reach the unvaccinated.
What we are doing in this area is working with a network of voluntary community mobilizers in the states that are most affected, and most of them that Eduardo has already mentioned, the ones that have the most zero-dose children.
Most of them are well aligned with the states that they have worst indicators in health and as well in other indices of the countries. Because zero dose at the end is an indicator, a proxy for poverty, right? If in 8 weeks of life a child has not been able to get a vaccine, it means as well that doesn't have access to water, to nutrition, eventually to education. It's a proxy for poverty.
Experts here believe that better investment on community health workers, increasing the use of data, and having health centers closer to residents will help to improve the vaccination numbers. Kemi Balogun, TVC News, Abuja.